Hey guys, and welcome to How to Gastro. It's been a hot minute since I've done a video on this channel, and I thought about coming back and starting to make videos again. So today we'll be talking a little bit about the complete blood count test, which is also commonly known as the full blood count or the FBC test. So this is a blood test and makes up part of the pathology in medicine. So let's talk a little bit about this today. So what is a complete blood count procedure? So it consists of step 1, step 2, and step 3. So a complete blood count test is typically done through a simple blood draw, where a healthcare professional will use a needle to draw blood, usually from a vein in your arm. Step 2 is when the needle is inserted into your vein, the blood is collected into one or more purple top or EDTA tubes. So as you can see in this little picture here, this is what the tube looks like. So the collected blood is then sent to a laboratory where it is analyzed using automated machines and sometimes manual methods to measure various components of the blood. So what is a complete blood count test or a full blood count test? So a complete blood count test, also known as the full blood count, is a common blood test used to evaluate your overall health and detect a variety of disorders, including anemia, infection, blood disorders, and many other diseases. So this is actually a panel test, which means that it measures several components and features of your blood. So the complete blood count test or the full blood count test actually measures the following components. It measures your white blood cells, your red blood cells, your platelets, your hemoglobin, your hematocrit, your mean corpuscular volume or mean cell volume, your mean corpuscular hemoglobin or your mean cell hemoglobin, your mean corpuscular hemoglobin concentration or MCHC, and your red cell distribution width. So this is actually the complete panel that makes up a complete blood count or a full blood count. So now what I'm going to do is I'm going to go through this entire list, exploring each component in a bit more detail. So we'll start with the white blood cells. So what are the white blood cells? White blood cells, or WBCs, also known as leukocytes, are a vital component of our immune systems. Their primary function is to protect the body against infections and foreign invaders such as bacteria, viruses, and parasites. White blood cells circulate in our blood and can move to areas of infection or injury where they are able to fight off pathogens. So there are actually several types of white blood cells, and each of them have a specific role in the immune response. So if we take a closer look at this complete blood count test, we see the WBC level, which is an actual level of all the white blood cells in the blood. And then we have a diff or a differential at the bottom. So the CBC actually includes both a complete blood count with a differential. So the differential actually differentiates the different types of white blood cells. So let's explore them in a bit more detail. So there are several types of white blood cells, each with a specific role in the immune response. They are the neutrophils, which are the most abundant type of white blood cell, and they actually are the first responders to infection and are highly effective in attacking bacteria and fungi. So usually when we see an increase in the neutrophil level, it'll point us to a bacterial or fungal infection in the body. So usually speaking, in a bacterial infection, your white blood cell count will be increased. And if you had to take a closer look at the differential, you'll see the neutrophil level also increased. So each of these have their normal values, which also helps the physician and guides them towards the actual cause of the illness. We then have the lymphocytes, and these include the T cells and the B cells and the natural killer cells. So the T cells help regulate immune responses, the B cells produce antibodies, and the natural killer cells target and destroy infected or cancerous cells. So lymphocytes are highly effective in attacking viruses. So we'll usually see an increase in the lymphocyte value during a current viral infection. So the monocytes, these cells transform into macrophages and dendritic cells once they leave the bloodstream, engulfing and digesting pathogens and dead cells. We then have the eosinophils, and these cells are primarily involved in combating parasitic infections, and they also play a role in allergic reactions. So usually a high eosinophil count will actually point towards either a parasitic infection or a current allergic response in a patient. We then have the basophils, and these cells release histamine and other chemicals that are involved in inflammatory responses and allergic reactions. So together with the eosinophils, if the basophils are increased, it will definitely be pointing to an allergic reaction. So a normal white blood cell count varies depending on the age and overall health of the patient, but typically it ranges from about 4,000 to 11,000 cells per microliter of blood. So this is what it should be in that range. So between 4 to 11 per microliter of blood. So moving along, what are the red blood cells? So the red blood cells, which are also known as the erythrocytes, are the most common type of blood cell in the human body. They are essential for transporting oxygen from the lungs to the tissues throughout the body and returning carbon dioxide from the tissues back to the lungs for exhalation. So a normal red blood cell count in men is approximately 4.7 to 6.1 million cells per microliter. In women, it's approximately 4.2 to 5.4 million cells per microliter. And in children, the range can actually vary depending on age, but it is generally similar to adults. So interpreting the results, a low RBC count or red blood cell count usually points towards an anemia, and this may indicate an iron deficiency, a chronic kidney disease, bone marrow problems, or chronic blood loss. So a high RBC cell count is called polycythemia, and this could be due to dehydration, living at high altitudes, smoking, or even conditions like polycythemia vera. So making up the third component of the full blood count or the complete blood count are the platelets. So what are the platelets? So the platelets are also known as thrombocytes, and they are small disc-shaped cell fragments in the blood that play a crucial role in blood clotting and wound healing. So unlike the red cells and the white blood cells, the platelets are not complete cells themselves, but are fragments of a larger type of cell called a megakaryocyte, which is found in the bone marrow. So the key functions of the platelets is number one, blood clotting. So the platelets are essential for stopping bleeding when blood vessels are injured. And when a blood vessel is damaged, platelets quickly adhere to the site of injury, clump together, and form a temporary plug by releasing chemicals that further attract more platelets. Number two, they are involved in the formation of fibrin clots. So in addition to forming a platelet plug, platelets also help initiate the production of fibrin, which is a protein that weaves through the platelet plug to create a more stable and solid clot, which seals the wound up nicely and prevents further blood loss. And the third component of platelets is that they play a major role in wound healing. So platelets also release growth factors that help in tissue repair and regeneration. These factors promote the healing of the injured area by encouraging the growth of new cells and blood vessels. So the normal platelet count in a healthy, typical individual ranges from about 150,000 to 450,000 platelets per microliter of blood. So if somebody had to have a low platelet count, it is a medical term called thrombocytopenia, and a low platelet count can lead to excessive bleeding and is associated with conditions such as bone marrow disorders, the use of certain medications such as carbamazepine, ceftriaxone, heparin, ibuprofen, penicillin, rifampicin, vancomycin, etc. It can also be due to autoimmune diseases and severe infections. So a high platelet count, on the other hand, is called thrombocytosis, and an elevated platelet count can increase the risk of blood clots forming in the body, which can lead to conditions like a stroke or a heart attack. So thrombocytosis can occur due to factors such as inflammation, infection, or even bone marrow diseases. So making up the fourth component of the complete blood count, we have hemoglobin. So what is hemoglobin? Hemoglobin, or Hb, is an essential protein that is found in the red blood cells that is responsible for transporting oxygen from the lungs to the body's tissues and carrying carbon dioxide from the tissues back to the lungs to be exhaled. It is a key component in maintaining the body's oxygen supply and supporting cellular function. So hemoglobin is made up of 4 protein subunits, and each of them contain a heme group. The heme group also contains an ion, which binds to the oxygen molecules. So if we take a closer look at this picture down here, we see this little blood vessel with all these red blood cells flowing through, millions of them at a time. And then we take a closer look at one of those red blood cells. We see it's made up of all these hemoglobin components. And if we take a closer look at this hemoglobin molecule, we see it's made up of these 4 protein subunits, and each of them contain in the middle an ion, which binds to the oxygen molecule. So this one subunit is here, and then we can see the little ion in the middle, which actually binds to the oxygen molecules. So the functions of hemoglobin, they are involved in oxygen transport. So hemoglobin picks up oxygen in the lungs and carries it through the bloodstream to the tissues and the organs. There it releases oxygen for the use in energy production. Then it's also involved in carbon dioxide transport. So hemoglobin also helps transport carbon dioxide, which is a waste product of cellular metabolism, from the tissues back to the lungs for exhalation. And then another function of hemoglobin is buffering. So hemoglobin also plays a role in regulating the blood pH by binding to hydrogen ions, helping to maintain the body's acid-base balance. So now let's talk a little bit about the hemoglobin levels and what normal ranges should look like. So normal ranges of hemoglobin will vary depending on age, sex, and overall health. But in men, it's usually between 13.8 to 17.2 grams per deciliter. In women, it's usually about 12.1 to 15.1 grams per deciliter. And in children, the normal ranges will vary with age. So what do low levels mean? So low levels of hemoglobin will also point us towards an anemia. So low levels of hemoglobin can indicate an anemia, which can result from various causes, such as an iron deficiency, chronic disease, bone marrow issues, or blood loss. And symptoms of anemia will include fatigue, weakness, and shortness of breath. So high hemoglobin levels, on the other hand, can occur due to conditions like polycythemia vera, living at high altitudes, dehydration, or chronic lung disease. So high hemoglobin levels can also increase the risk of blood clots occurring in the body. So moving along, now we'll talk a little bit about the hematocrit, which also forms part of the complete blood count. So the hematocrit is a blood test that measures the proportion of red blood cells in the blood. So it is typically expressed as a percentage and is a crucial indicator of the blood's ability to carry oxygen throughout the body. So when a blood sample is received in the laboratory, it is centrifuged, which means it's spun at a very high rate. And in that tube, what actually happens is the plasma separates away from the red blood cells and the white blood cells and platelets. So the complete percentage of the tube that consists of the red blood cells makes up the hematocrit. So the hematocrit is the ratio of the volume of red blood cells to the total volume of blood. For example, if the hematocrit is 45%, this means that 45% of the blood's volume is made up of red blood cells. So the normal ranges of the hematocrit in men, it's approximately 38.3% to 48.6%. In women, it's approximately 35.5% to 44.9%. And in children, the normal ranges will vary with age. So why is this clinically important? So since the red blood cells are responsible for carrying oxygen, the hematocrit level is directly related to the blood's oxygen carrying capacity. So a high hematocrit indicates a higher concentration of red blood cells, which does mean that it can carry more oxygen. So the hematocrit is used to evaluate an anemia. So a low hematocrit level may indicate an anemia, which is a condition where the blood doesn't have enough red blood cells or hemoglobin, leading to reduced oxygen transport and symptoms like fatigue and weakness. So it can also be used to assess dehydration. So hematocrit levels can rise, which means they'll be greater in percentage in cases of dehydration because the volume of plasma, which is the liquid part of blood, decreases, making the red blood cells more concentrated. So if a patient had to come in with severe dehydration, the plasma amount will obviously be much lower, meaning that if we had to look at the ratio of red blood cells to the level of the plasma, the red blood cells will be a lot more increased and the plasma levels will be very decreased, so the hematocrit would be high. So the hematocrit is also useful in the evaluation of polycythemia. So a high hematocrit level may indicate polycythemia, which is a condition where the body produces too many red blood cells. And this can also increase the risk of blood clots, stroke, or a heart attack. So now let's talk about the mean corpuscular volume or the mean cell volume. So the mean corpuscular volume or MCV is a measure of the average size or volume of a single red blood cell or a RBC. So how do we calculate this MCV? So the MCV is calculated by dividing the total volume of red blood cells by the number of red blood cells in the blood sample. So it is typically expressed in femtoliters, which is a unit of volume equal to 10 to the power of negative 15 liters. So the normal range for a healthy adult is generally between 80 and 100 femtoliters. So this would be a normal cytic red blood cell or a normal sized red blood cell, which is 80 to 100 femtoliters. So why is the MCV clinically important? So in microcytic anemias, meaning we have a smaller than usual red blood cell, this can point us to a sign of iron deficiency anemia, which is actually the most common cause of microcytic anemia, often due to inadequate iron intake in the patient's diet or chronic blood loss. It can also point us to thalassemia, which is a genetic disorder that affects hemoglobin production, leading to smaller than usual red blood cells. So a low MCV indicates a microcytic red blood cell or a smaller than usual red blood cell, which can be a sign of iron deficiency anemia or thalassemia. Then we get normocytic anemia, which has normal MCV or a normal sized red blood cell. So if the MCV is within normal range, but the patient is anemic, it can be due to chronic disease. So anemia of chronic disease or conditions like chronic kidney disease can lead to a normocytic anemia. It can also point us to an acute blood loss, so a sudden loss of blood, such as from a trauma or a surgery, can also result in normocytic anemias. Then we'll have macrocytic anemias, and this is when the MCV will be greater than 100. So when the MCV is above the normal range, it will suggest that the red blood cells are larger than normal, which are called macrocytic red blood cells or macrocytic anemias. So this can be due to a vitamin B12 or a folate deficiency, and these vitamins are essential for proper red cell production, and a deficiency can lead to larger or immature red blood cells. Another cause is alcoholism. So chronic alcohol use can affect the red blood cell production and may also lead to macrocytosis. And then liver disease as well. Liver disease can also cause an increase in the MCV. So what is the mean corpuscular hemoglobin, or the MCH? So the MCH is a measure of the average amount of hemoglobin which is found in a single red blood cell. So how do we calculate this MCH? So the mean corpuscular hemoglobin level is calculated by dividing the total hemoglobin by the number of red blood cells in a blood sample. It is typically expressed in picograms, where 1 picogram equals 10 to the power of negative 12 grams. So the normal range of the MCH, or mean corpuscular hemoglobin, is usually between 27 and 33 picograms per cell. So why is the MCH clinically important? So a low MCH points to hypochromic anemia. So now we talk about chroma, which means color. So the hemoglobin actually gives the red blood cells its beautiful color. So if we speak about a hypochromic anemia, it means less than colorful anemia, which points us to an MCH value which is lower than normal. So it would be lower than 27. And this indicates that each red blood cell contains less hemoglobin than usual, and this condition is often seen in iron deficiency anemias, and this is the most common cause of a low MCH, where there is not enough iron available to produce sufficient hemoglobin. Another cause is thalassemia, which is a genetic disorder that results in the production of abnormal hemoglobin, leading to lower than normal MCH levels. We then have the normal MCH, which is a normochromic anemia, which means our patient's value did fall within the normal range of 27 and 33 picograms, and the color of the blood looks normal or normochromic, but now we still have fewer red blood cells or another underlying issue. So the causes of a normochromic anemia includes anemia of chronic disease, which includes conditions like chronic inflammation, infection, or kidney disease that can result in normochromic anemias. The patient could have also suffered an acute blood loss, where sudden bleeding, whether from surgery or trauma or internal bleeding, like a bleeding ulcer, for example, can lead to normochromic anemia. And then finally, we can have a high MCH, which is a hyperchromic anemia, which means a very dark, brightly colored blood sample. So here the MCH will be higher than normal, and it means that our red blood cells contain more hemoglobin than usual. And this condition is often seen in a vitamin B12 or folate deficiency, and a deficiency in these vitamins leads to the production of fewer but larger red blood cells that contain more hemoglobin, or a macrocytic anemia, where larger than normal red blood cells, called macrocytes, often have a high MCH value, which can occur in conditions like alcoholism or chronic liver disease. So now let's talk a little bit about the mean corpuscular hemoglobin concentration, or the MCHC. So the mean corpuscular hemoglobin concentration is a measure used in blood tests to determine the average concentration of hemoglobin in a given volume of red blood cells, or RBCs. So now how do we calculate the mean corpuscular hemoglobin concentration? So the MCHC is calculated by dividing the hemoglobin concentration by the hematocrit. And remember, the hematocrit was the proportion of the blood volume occupied by the red blood cells. So the MCHC helps in diagnosing various types of anemia as well as other blood disorders. So why is MCHC clinically important? So normal MCHC levels typically range from 320 to 360 grams per liter, and abnormal levels can indicate different conditions, such as a low MCHC, which looks something like this picture, might suggest conditions like hyperchromic anemias or an iron deficiency anemia. A high MCHC, on the other hand, can be associated with conditions like spherocytosis or hyperchromic anemias. And finally, the last component of the complete blood count, or the FBC, full blood count, is the red cell distribution width, or RDW. So the red cell distribution width is a measure used in blood tests to assess the variation in size and volume of the red blood cells. It reflects the degree of anisocytosis, which is the variation in the red blood cell size. So if we actually had to measure the difference in size of these red blood cells, that's actually what the red cell distribution width measures. So why is this clinically important? So a normal RDW range is typically between 11.5% and 14.5%. But sometimes we can find abnormal levels of RDW. So this can actually occur in various conditions. So an increased RDW can be a sign of anemia, such as an iron deficiency anemia or a B12 deficiency, recent blood loss, or other conditions causing variability in the size of red blood cells. So a decreased RDW is less common and isn't usually a cause for concern. So I do want to point that out, but may be seen in certain types of anemia as well, or other conditions. So in conclusion, as we have just seen, the complete blood count can help diagnose a range of conditions, including anemia, infections, and other hematological disorders. It is a routine test that can provide valuable information about your overall health and help guide further testing or treatment if needed. So thank you guys so much for watching. I hope you found this presentation quite valuable and informative. Please make sure to like, comment, subscribe, and share this video with some of your friends in the medical community who might find this video important. Wishing you a wonderful day further. Take care and bye for now.